everyone, thank you for tuning in to our vlog. Today's topic is a difficult one, and of course it pertains to Americans, older Americans who have Medicare Part A, B, D, and may at times want to enroll in an HMO, which is a managed care for their Medicare. So you're signing over your Medicare to an HMO such as Kaiser. And the difficulty with HMOs and Alzheimer's disease is multifold. There's just many different topics to go into. However, it does work for some families, and the HMO can be something that is easily worked out. They may have a Kaiser doctor they've had for years that's worked, and they have a good relationship with that person. They may just really feel like they're used to that system, that lab tech, all those different things, that it's continuity of care and they're happy. However, if you're going to move your older adult into a facility, and the reason I'm talking about this is it's open enrollment right now as we speak, you have choices. You can disenroll and go on to Medicare and get a supplement. So Medicare is designed 80-20, and there's medication plans. So you'd have to look into that. However, with Alzheimer's disease, think of it as breast cancer, because we've all struggled with it. And with breast cancer, you want to pick a specialist. You don't want to go to just an oncologist. I would think you'd want to go to someone who specializes in breast cancer, who really understands breast cancer. A breast surgeon, same thing. You don't want to go to a general surgeon. You really want to go to someone who's really a breast surgeon. So going back to Alzheimer's, I really feel needing a geriatrician or an internist with a huge background is critical. And sometimes if you're in an HMO, they aren't going to have that. They also aren't going to have physicians willing to go to the facility. I have not seen yet with many of the HMOs, the ones I've experienced with, a visiting doctor. And it's very, very rare. I'm sure there are a few that take HMOs that come out, but it's very rare. They usually would like private pay or Medicare and a supplement. So it's very difficult once you move your mom into assisted living, board and care, in-home, even in-home care. You have 24-hour care for her, yet you have to take her out to the doctors. Well, going out to the doctors is difficult. In a big system like Kaiser, it's very difficult. It's disorienting. Going back and forth to the ER is disorienting. So we want to reduce that by having the physician come to them. And the only way to really have that top-notch care is to have Medicare and a supplement. It's just so difficult to take someone late stage out for labs, someone late stage out for a chest x-ray, when you could have had that in-home. And with Medicare, you can. So same with the doctors. You want a physician to see them in their own environment, where they're living, what is the lighting, what is the sound, what is the antecedent to all these behaviors that maybe that facility is seeing. That physician should see that area. Taking them to their doctor's office, they can mask, they can all of a sudden become normal, they can also be really, really disoriented and upset that you took them in a car or in an ambulance or in a transport just to go to the doctors. So it's really critical to note that you have a choice. You can have Medicare and a supplement, or you can have an HMO that probably isn't going to have that doctor coming out to the facility. Then remind you also, the facility probably has a medical director or a physician that's visiting quite often. So that doctor is going to have some protocols with those nurses and employees that really work, such as fax my office for change of order, call me with this, call me with that. Our goal is to keep older adults out of the ER. That's really hard to do with an HMO. And also families are taking them to the doctor. So when the family returns back, do they always give us all the information? No. Does the doctor always, their own personal doctor, do they always fax us change of orders? No. Remind. And with an HMO, are we getting the right doctor? So it's very complicated. Another idea you need to think about is labs. With an HMO, you need to go out to the lab a lot of times. With Medicare, the lab comes to you. So it's labs, chest x-rays, physicians. You need to look at the whole picture. Alzheimer's disease is really complicated. And if it's a little easier to manage on everyone, it works out better. And the older adult gets better care. So I just really want to make sure I emphasize that do your research, do your background check on that HMO. And just because you've been in it your whole life doesn't mean you can't change. Thank you for tuning in.